Hello,
Yeah,
everyone. Today we would like to interview Thompson Robin about the PsyTech VR workshop we had the last Friday. Tom, so if you can introduce yourself and tell us about the field of practice you work with and about the organization, please.
yeah, absolutely. My name is Thompson Robin, aka Tom. I'm a registered provisional psychologist here in Calgary, Alberta. I work with Virtuous Circle Counseling, and the type of clients that I work with is people. I work with individuals, couples, and families. I work with anxiety, trauma, stress, depression, relationship issues, just to name a few. Um, Started this about almost 3 years ago as a registered provisional psychologist. I also have worked as a Canadian certified counselor before that for about 1 to 2 years in 2021. So, and I've worked with clients who have been in motor vehicle accidents. So certainly, trauma and the various anxiety and personality changes that come from that. I've worked with clients in that area as well. So that's the overall scope of my practice. Yeah.
Excellent, excellent. Okay, thanks for sharing. Like the very next reasonable question would be, what are the areas where you apply PsyTech VR? Is it more like relaxation practice with your client, or you also try exposure therapy with your clients in VR?
Yeah, I do a combination of both. Actually, before I did the training with PsyTechVR, I also did training with Evergreen certifications for cognitive behavioral therapy, exposure response prevention, so that I was able to, utilize the SciTech VR technologies for both relaxation and exposure purposes.
Mhm.
And I'm sure we'll get into it later, but I can explain more about how that looks like in more detail.
Mhm. Oh, great. So if we take a one step back, so you mentioned you received the training from PsyTech VR, which was the technical training, more like a technical onboarded. But next, after
Mm.
a few months, PsyTech VR start providing workshops. Can
Mm.
you can you let us know something about the workshop you joined and what motivated you to join this workshop?
Yeah, absolutely. So once I did my other certification, I did the SciTech VR as a CBT workshop. I think it was a 3 hour thing there that was able to help me to really expand the things I've really learned before and apply it in a virtual reality type of manner. So being able to use the technology to incorporate those types of principles around exposure, around relaxation, around reorienting a person's way of thinking and way of approaching an anxiety inducing or previously traumatic situation in those environments prior to them having to go out into those environments. So I really wanted to do that SciTech VR workshop to be able to solidify what I've learned before and increase my learning and understanding of things even further so I could be able to smoothly incorporate the technology while also being therapeutically proficient, in being able to help my clients.
Great, great. Okay, that's very well received.
Mm.
Just a question about like for those therapists who just start thinking about the VR, maybe haven't purchased the headset, but just want to learn more about the VR CBT therapy. So what would you say to other professionals who are considering attending the workshop?
Yeah, I would definitely encourage those who are looking for training, especially with wanting to incorporate VR into practice. I definitely um, encourage them to take this type of course because I think it's important not only to have the therapeutic knowledge and background based on the theoretical information and philosophies that we've learned, but also be able to know how to technologically apply it in a way that can be very that in a way that would be very again, smooth for our clients. That's not without any hiccups, without any sort of problems when that can come with technology. You want to be able to make sure that you feel comfortable with using technology, the different features that you can use inside Tech VR, so that the client's experience is as smooth and comfortable as possible. So yeah, I definitely encourage, those to take this course so that they can be able to have this sort of additional knowledge and competency that ultimately can bring about another layer of help for our clients that I think is definitely needed, especially when there are certain situations we can't really replicate. It's not necessarily safe to replicate in the real world, or if it is going to be something that's replicable in the real world, something to get them prepared so that they're not caught off guard or caught by surprise, that they can be able to feel confident going into those areas. So I think that PsyTechVR's training will definitely be helpful to get, us as professionals to be there for our clients.
Oh, Tom, that was a very complete answer. Thank you, and I'm
Yeah.
sure this new therapists, new VR therapists will find it helpful. And because just a few minutes ago you said that you could share maybe some more practices, like how you apply the VR. Would you like to take a look at a certain case, or just to give any more detailed thing about how you apply this?
Yeah, absolutely. And of course, without sharing any identifying information, for confidentiality purposes, I already have the one, I have a client in mind that I can share the procedure that I went through. So of course, as therapists, the number one thing we need to do is informed consent and ensure that before a client, and this is actually something that was emphasized in the PsyTech VR training, before you engage in VR therapy sessions with your clients, you want to make sure that they A, consent to the process, and B, that they're bought in. You want to make sure that they're ready to do that. That's the most important factor and I believe for the success of VR. So we go through the informed consent process, go through the risks and benefits, making sure that the client is actually ready to do something like this, make sure they don't have any contraindicating conditions like epilepsy or motion sickness before they go into this sort of VR experience. Make sure they understand that this is, one side of therapy, and it's not just the end all be all. So it's a part of the process of their overall therapeutic treatment. So what this would look like, we do the informed consent process, and then we get the client adjusted to the VR technology. So set up the boundary, make sure that they are aware of how to use the controllers, get them familiarized with the VR environment inside the helmet, and then, or the headset, I should say. And then once we do that, the first thing I do is establish the safe space. I think that's the most important thing, because we don't want the client who is having something very stressful or traumatic for them or anxiety inducing. We don't want them to just go jump right into the type of environment that causes them stress or anxiety. We want to get them to feel comfortable and familiarized with the VR environment. So we definitely set up that safe place, whatever they want it to look like. In the safe place, what I then do is go through some relaxation exercises. Well, really first is a body scan, help them to really acclimate and understand and tune into what their body is going through. After which we do some grounding, breathing, or meditative exercises. One of my favorite ones is getting them to go through box breathing, getting them to connect with their breath. And then once we do that, then we go into the exposure environment. We get them to share what exactly type of environment they'd like to be in. So whether it's one of PsyTech's pre-recorded environments that are already there, or we get the AI to set it up. that's a bit more unique. We get them to do that. And then afterwards, get them to see how they feel in that exposure environment. If by any chance the environment gets too much, the beautiful thing is we can always jump back to the safe place and restructure things. Now, what's interesting is that with ERP, the principle behind ERP is that we don't necessarily want our clients to, we don't always necessarily want our clients to be going to relaxation procedures all the time. We want clients to be able to learn how to bear through an anxious environment, because part of it is being able to know your body's process of going through an anxiety experience. When our bodies go into its sympathetic nervous system, the polyvagal theory talks about how we go into the arousal, but then we ultimately come out of the arousal. So part of it is that we don't necessarily want the client always to just have to escape, into the safe place. However, that is always a possibility, especially if the client is not necessarily ready to be able to bear through an entire exposure environment. We always want to make sure that we're still working with our client and working with where they're at. So then that's what I end up doing, using the safe place. And then after everything is said and done, we then go through a debriefing process, get them to, discuss how they felt about the experience, what they would like to do in the future, is there anything they'd like to change, and really just make sure that they were okay with that experience being in VR, and making sure the VR experience really actually fit what they needed, because sometimes it may not fit. Sometimes you find out that what they initially thought was one anxiety inducing issue was actually symptomatic of something even deeper, something different. So that's essentially the whole process of what I do in a VR session.
We just 10 minutes ago we talked about a small teaser for our course. I think you just great job, Tom. So it was very complete. I really appreciate for such a feedback. So I hope our viewers will have a chance before trying the workshop, understand how cool it is, and like learn more about our participants. So Tom, thanks for your time. I'll put it on stop, and thanks everyone for watching.
Yeah, no problem. Thank you, Daniel.